tummy tucks. The skin of the belly actually stretches out, as you can imagine with the pregnancy. They actually separate and they never come back together. Muscles of the abdomen. So today we're going to go ahead and talk about tummy tucks. I'm Dr. Saddat, a Beverly Hills plastic surgeon, and I want to give you all the details that you need to know if you're considering having a tummy tuck or have ever wondered what actually goes into the process of getting one done. Now, the most common tummy tucks that I personally do are going to be for postpartum moms, meaning moms who have had children, and usually a few years out. Why is that? Because during pregnancy, almost always, especially after more than one pregnancy, what happens is that the skin of the belly actually stretches out, as you can imagine with the pregnancy, and when things go back to normal once the baby is born, usually they're not going to fall back exactly where they once were, including things such as stretched out skin, an increased distribution of fat in the abdomen, and also a problem that really can't be fixed without surgery known as diastasis recti. That is where the muscles of the abdomen, which are your six-pack muscles that sit right here in the front, they actually separate and they never come back together because of the stretch that happens during pregnancy. So what does that mean for you if that happens? Well, ultimately that means that you're going to lose out on the main function of your front core muscles, and therefore more pressure is going to be distributed to the back, which is why it's very common for women who have especially had more than one child to complain of things such as lower back pain as they get older, because oftentimes their core muscle is not functioning appropriately to give them enough balance to give their body that stability that it needs. Now, in a tummy tuck, what exactly is it? Oftentimes I hear people confusing tummy tuck and liposuction with one another. Just to clarify, liposuction is exactly what it sounds like. Liposuction, lipo means fat, suction means suction. So that's where you actually place a cannula or almost like a tube into the body and you suction out fat without removing any skin. Now this is oftentimes not a great result for most mothers, especially if you have stretched out skin, because even if I remove the fat, at the end of the day that skin is already stretched out. So by removing any volume underneath the skin, it may actually make the sagging worse. And when it comes to the diastasis that I was talking about with the muscle separation, liposuction does absolutely nothing to fix that. And that's why sometimes women who do get just liposuction done after having children, they'll get a flatter lower stomach, but then the bulge above the belly button will actually get worse because that's where the diastasis shows itself most. So you'll get that bulging of the intestinal tissue out above the belly button, which is really not an aesthetic most people like. So that's where a tummy tuck comes into play. A tummy tuck means removal of fat and skin through an incision that's usually from hip bone to hip bone. Typically, I like to make the incision low as possible. That way you can hide it in your bikini line. One thing I'll often have my patients do is actually bring in a dream bikini that they would like to wear, at least the bottoms of it, during the time of the surgery. Beforehand, when I'm doing all the markings, I'll actually plan to place the incision line directly into where that bikini line is. So that way, when you wear a bikini after you're all recovered, you won't be able to see the scar and you'll be able to show off that new tummy. Now, what happens during a tummy tuck, once I make that incision, usually I remove a good portion of the skin that's under the belly button in almost an elliptical type fashion. I remove that skin out and then you lift the skin and fat up off of the abdominal muscles all the way up to here, almost to basically where the chest bones and ribs begin. Why do I do that? Because that's what's going to expose the diastasis that I had told you about. Now, how do I fix the diastasis? Well, I literally go in, I look at it, and it's very visible to see once you're in there in the operating room, especially to a trained surgical eye. And then I use stitches, a mixture of dissolvable and permanent stitches, to bring those muscles together and sew them in a way that they were before you had children, therefore allowing those muscles to be put back on tension and redistributing that core strength back to the front, rather than completely relying on those back spinal erector muscles and your obliques to do all the work whenever you're doing any core muscle function. Now, on top of that too, oftentimes I'll do some liposuction, especially along the flanks and the sides, just to really accentuate that hourglass shape. And with that, usually I will place 1 or 2 drains into the abdomen after surgery once everything is closed up. I know there is a big movement towards doing drainless tummy tucks. I have done them sometimes, but the one thing I don't really like about drainless tummy tucks is the risk of something called seroma, which is essentially a fluid collection, and that's exactly what placing a drain prevents. Now, if you do the drainless technique, it's possible, but it's also much more likely that you do develop a seroma afterwards, which isn't a catastrophic result, but what it does mean is that you would just have to come into the office every 2-3 days to basically have a needle put into the belly and then that fluid removed removed, and then you'd have to wear compression for at least 6 to 8 weeks or so in order to ensure that that sticks down. So I find that with the drain, as much as it can be uncomfortable to have it for the first 5 to 7 days, usually patients are a lot happier than if they have to come back constantly to have a seroma drain. So if you're interested in having a tummy tuck, I hope this kind of explains what the process is. One thing I also like to tell people is about the recovery. Personally, I think tummy tucks are some of the more challenging recovery for any of the operations that I perform. Why is that? Again, because it's affecting those core muscles, and you will really realize very quickly how much your core muscles come in handy when you have them operated on, because you won't be able to do things like sit up with ease or engage that core very well for the first 4 to 6 weeks. So I usually tell people no heavy lifting for 4 weeks, wearing compression for about 6 weeks after surgery, and really kind of taking it easy for that first month just to make sure that that repair is nice and strong. And then slowly you can start integrating core strength function back in by doing ab exercises and such, and you'll quickly notice that that lower back pain and those issues that you had before will hopefully resolve. So again, if you're interested in having this procedure done or have any more questions and want to schedule a consultation with me, go ahead and contact my office, and I would love to talk to you about it.